Hello, hello. I am Dr. Terri Major Kincaid, and I'm a neonatologist in Dallas, Texas, and I specialize in the care of newborn infants, preterm infants, and term babies that may have significant health problems. And I was just taking a break to sit out here in the sunshine today and talk to you guys a little bit about jaundice. And why am I out in the sunshine, and why do I want to talk to you about jaundice today? And the reason I wanted to talk to you about jaundice today is because some of you may have heard that we received an update today that Beyonce and Jay-Z's twins remain hospitalized and that they are currently being treated for jaundice. And so I just wanted to say a few words about jaundice. First of all, this is day 9 for the twins, and I suspect that the twins were a little early, so I'm not surprised that they're still in the hospital for day of life 9. I'm also not surprised that they're being treated for jaundice. Jaundice is very common. In fact, most infants will have jaundice. Not jaundice that necessarily has to be treated or jaundice that you can clinically see, but most infants will have jaundice. So what is jaundice? Jaundice specifically refers to the appearance of the skin being yellow, or if you have a lot of jaundice, you may look more red or sometimes even green. Jaundice represents just the breakdown of hemoglobin, which is a protein in our red blood cells. Once those red blood cells die and the protein is broken down, they are cleared by the liver through our bile. So your liver is like your plumbing system. So its job is to get rid of all the impurities. So when we are first born, our liver isn't doing that much. Why? Because mom's placenta was doing that. So it takes the liver a while to kind of wake up and say, oh, I'm supposed to be doing something. So for most babies, the way that the liver is able to clear the hemoglobin once it's broken down is just by fluid intake. So the more the baby eats, the more the baby poops, and the baby is able to clear the bilirubin from the body that way through the stool. That is why when the babies are first born, you will notice that the stool initially will appear, more black or dark, the meconium, and then eventually it should change to a more yellow, brown, golden color. Yeah, if you're a pediatrician, you got to pay attention to stool. So for most babies, this process gets better over a 2 to 5 day period. For some babies, it may take a little longer. So for premature babies, it will take even longer. And why is that? It's because they usually aren't eating as much as a term infant, so they're not getting as much fluid. So it takes them a little more while to poop. They're at higher risk for dehydration, and their jaundice stays around a little longer. So it's not a serious condition in most infants because jaundice is physiologic. The way we treat jaundice for babies is to put them. For most babies, as I mentioned, they should be able to eat and poop and clear their jaundice. But if they're not able to and they reach certain levels that we would be concerned about, then we can put them under a special light, the phototherapy light. And that light, when it's shown on the skin, allows the jaundice, the bilirubin, or the bilirubin to be broken down, have oxygen added to that, and then it's more easy for the liver to clear that from the body. So it oxidizes the hemoglobin so that it can be better cleared from the body. And that's why we use the phototherapy light. So you can use a spotlight or you can use a blanket light. And so one of the most common things I hear in the ICU nursery, especially if I'm taking care of a family and grandma's present, is why can't we just put the baby in the sunlight? In the old days, we just put the baby in the sunlight. Now come out here in the sunlight today. Well, if the number is high enough, sunlight is not going to be enough. So we generally do not use sunlight as our primary form of therapy for significant hyperbilirubinemia. And why do we care about hyperbilirubinemia? The reason we care about hyperbilirubinemia is because if the level gets high enough, it can affect the brain and cause significant brain damage. It can cause deafness. The babies can have a condition called kernicterus, where they can be very stiff. And so this can be a life-threatening condition. So we make sure that we stay away from the levels that have been associated with those major side effects. So for most babies, jaundice is physiologic. for some other babies, so jaundice is not physiologic. So some babies can have high levels of their bilirubin because of an issue with their red blood cell type. They can have a condition that causes their red blood cells to break down more frequently, so therefore the liver has more to clear. You can have jaundice because you're born with an infection that has stressed your system, that is causing you to have more jaundice. You can have a primary problem with your liver, and some babies can have jaundice that shows up later. It's low-grade jaundice, but it'll show up later due to breastfeeding. So hopefully the twins have the regular physiologic jaundice that I mentioned earlier. 9 days would be a while to require treatment for jaundice. Remember, I said most babies will get better in a couple of days, but if you're premature, it's not uncommon that it takes a little while longer for those conditions to be cured. Okay, so those are Dr. Terry's tips for today about jaundice. Just to review, jaundice is the way the body, jaundice is when the skin appears more yellow or red or sometimes even green, and it represents a buildup of bilirubin, which is a breakdown from red blood cells that are cleared by the liver through the bile system. And we normally treat that with phototherapy, not just sunlight, in a baby if the numbers are high enough. Now in adults, usually the reason that they may have jaundice is going to be a primary problem with the liver, the biliary tract, some other issues going on. But today I'm talking about babies because I only do the little people. So hope you guys get some sunshine today, and I hope that was helpful, and hopefully Beyonce and Jay-Z's twins will be out of the hospital soon. I'm hoping and praying for that. I'm sure you are too. You guys have a good one. Bye-bye.